uključili uživo za današnje nedelje. Veliko mi je zadovoljstvo da vas pozdravim i da pozdravim moje goste. Ja ću ukratko da vam ih predstavim i naročito na engleskom. I am very happy that we will work and learn from our teachers. This is Professor Tinirello from Brescia. He will work first procedure. It is radio frequency ablation of the knee. This is Professor Thomas Haag from North Wales Hospital from Great Britain. He will work on radio frequency ablation of shoulder. We will talk a little bit more later. And this is Professor Iva Radoš from Osijek. He will work on radio frequency ablation of medial branch block. Dear colleagues, thank you for your time.
Thank you for the invitation.
I hope that we can start and you will explain us everything.
Absolutely.
Okay, now we can start with this. Professor Tinirello, please.
Yes. You put my gloves.
Okay. Treba vidjeti gdje su ekrani, gdje može da se gleda. Da ne stojimo bez veze. Ja bih sada, pošto ćemo biti drugi, rekao da odmah uvode u
Yeah, but with the water.
Tako da namestimo. Da mi odmah uvedemo sada pacijenta za leđa.
The gloves not glass.
I sad ćemo da ga namesti i on će da kaže kako i kakva je konkretna pozicija.
Okay. Is this
Ti ćeš da kažeš konkretnu poziciju ovog luka.
Navodit ću vas tako. I will gdje ovdje ćemo?
Tehničar angelsale i kontroliše, što će oni da pomeraju jednosene samo da klasično luki, bez to. Ali vidjet ćemo kad staviš ti napravi jedan flash da vidiš kakav je snima. Jer od toga zavisi da li ćemo ovdje koristiti, ne znam, 10 frejma, 15, 20. Što mi frejma manje zračenje. Da. Ćeš ti da kažeš, ako ti je slika sa 10 frejma, vidjet ćeš da je slika mi se čini bolje.
I use one cc of depot. I bring out to 5, up to 5, with pyrophene. 0.25. And here we go.
A ovdje, sad ima jedna stvar. Ti, mislim da je bolje da neko si strane, ako hoćeš ja mogu da... Znaš zašto? Ovo nije klasično kao na celuku da ga ti pipneš i pustiš. Jer ako ga pipneš kogu, da ti završen pravi film. Ne, treba da vidimo za ovo gdje ćemo staviti elektrodu, šta, ja ne mogu baš sve da se ti proti kažem.
Da li tu digitalna fotografija? Mi imamo na fluoroskopu normalna fotografija, ima digitalna koja je puno jasnija i istrija. Jer je digitalno puno više zračenja. Neki jastuk ispod. Aha, mi ćemo.
Kad me vidiš? Znači ti profesor vi, ti uđi tamo slikaj, ne se još biti sla snimanje. Do you want to go inside before the fluoroscopy or no? No. Because I want to close the door, I need to speak a little bit on the air. So I want to close the door. You want to go inside or you want before the fluoroscopy?
I'll wait.
Floor and superfloor.
Ne, pomeri ga skroz da on legne.
Do you think you have time for the other?
Ali moram da zatvorim vrata.
We'll see.
Kaži mi kad nađem koleno da me pustiš. I kaži mi kad idem, važi? Kad uđem u koleno, onda me puste, samo mi kaže kad mogu da krenem da pričam. Kad otvorim sliku kolena, kad budeš tamo sliku kolena, ti mi samo javi kad mogu da krenem da pričam.
Unfreeze.
Ok, kad ćete me prebaciti u prođe?
Ajde, freeze.
Ovo ga možda.
Unfreeze.
Ovdje imate tu parametre.
I mi kažem, samo ovako dođe kaže šta.
Samo da vidim.
Nikola, Andrea, I will speak a little bit about procedures so that you know and show some stuff, okay?
Like it's something that this is
Ako vraćaš onda na ovo odgovaranje.
Možda ne,
with the pro. We can just cut because this is sterile underneath. Yeah. Nož. Yeah. Nož.
onda vi okrećete...
Nemojte da slovite sve. No to, ništa više.
Našu stimulaciju.
Pitanje ga da pričamo sve.
Yeah. I did it just to be sure.
Zato što mi onda možemo...
Now we're reasoning.
Okay.
Yeah, okay, perfect.
That's cool.
So,
Joe, just a second.
To je okej, možda sam nema kriv.
Dobro jutro, poštovane kolege i koleginice, dobrodošli na naš webinar. Procedure. Prva procedura izvodit će dr. Andrea Tinirelli iz Breše i dr. Nikola Vasilijević iz KBC, dr. Dragiša Mišović i radit će proceduru radiofrekventnu ablaciju Q-leaf, radiofrekventnu ablaciju kolena. Na mojoj glavi je uređaj HoloLens koji se koristi za 3D tehnologiju, virtualnu tehnologiju i hoću da vam pokažem. Na slici, kao što vidite, su kolena našeg pacijenta. Onda je taj skenirano koleno prebačeno tako na sistem zahvaljujući Microsoftu i Apoclaru i sad ću vam pokazati kako možemo multislicenim skenerom da vidimo ta kolena i kako to izgleda. Znači, na ovaj način možemo da izvršimo dijagnostiku kolena i samih artritisa ili nekih drugih oboljenja kolena. Radi se inače o našem pacijentu koji je star 80 godina, posljednje 3 godine ima izuzetno jake bolove u oba kolena. Učinjena je dijagnostička blokada koja je dala pozitivan rezultat i zbog toga sada radimo Q-leaf radiofrekventnu ablaciju. Ono čemu nama HoloLens značajno pomaže, a to je da možemo potpuno da vidimo 3D modele naših pacijenata i kao što vidite ovdje, možemo da pogledamo kako to koleno izgleda i kako da tom kolenu u suštini pristupimo.
Uskoro ćemo početi.
Znači, možemo potpuno da okrećemo ovaj 3D model njenog kolena, da ga postavimo gdje želimo i na taj način da pre svega i mi provežbamo kako ćemo pristupiti tom kolenu. Sada možemo koristiti različite objekte. Na primjer, ovo je igla. I nju možemo onda pozicionirati tamo gdje tamo gdje želimo. Ovo je bilo u suštini jedna tačka genikularnog nerva.
how much more useful it is really to see in a hologram. You know what I mean? Does it really add more, you know, for something as simple as me? You know, if it's a bit more complex, I can see it really. Okay. I think it's a great idea in principle, but I think there is a lot of it needs.
Ako možemo sada kada pristupimo da pogledamo sa svih strana kako to u suštini i izgleda.
I think personally,
Pokazat ću vam sada još jednu mogućnost.
is one thing, separate, but not together with the clinical case. Clinical case, full focus on the clinical case.
Daj nam produžni kabel za struju. Kako čistije predao? Savija, imaš li produžni kabel za struju?
Možemo da gledamo kroz meka tkiva da dođemo tačno do kosti. Hvala vam puno. Ostavit ću vas doktoru Nikoli Vasilijeviću i doktoru Andreja Tenerelli da rade svoju proceduru.
I pustite tilt da možda okrećeš.
To je negdje pola sata. To je procedura najduža od ovih procedura.
Yeah, we can. I think that's not a great position on the C-arm because you see there is a part of the table. And, okay, on the right. Yeah, okay.
It's fiddly. It is fiddly. Very fiddly. I know this.
Intermediate. Okay. We will do with ultrasound and combined with the fluoroscopy, just to check where we are.
Makes the whole thing a bit more.
We already infiltrate the skin with a local anesthetic. We use lidocaine, okay, 1%. And now we start the procedure. So we get
The probe.
the needle.
The needle first and then the
I'll
probe.
take it. No problem. So this is the needle.
Just do it.
And inside the disc we will place our probe. So, let's check on the ultrasound. I put my femoral shaft in the middle. I need some gel.
Yeah.
More gel. Would you mind? Thank you. Thanks. Thanks, Nicole. Okay. There is a little bit of effusion over here. So we will try to skip it. And here we are. This is the femoral shaft in the middle of the screen. I rotate my probe. I see my shaft. I go down until I find here we are, the junction between the epiphysis and the diaphysis, which is almost here. Almost. Here we are. So this is the junction, and I see something pulsating in the middle. You see? Okay, super. This is the genicular artery. So that I use it as a reference for my needle, and I will place out of plane my needle. Nicole, if you will tell the patient that I'm going to stick a needle.
Biće ubod. Marija, biće sad jedan ubod.
Okay. If it's very painful, I will do some more local anesthetic. And here we are. Out of plane. It's okay. And now I'm against bone, close to the. Now we can check if we want with fluoroscopy where we are. Okay, you have to check because I have the pedal. So a little bit.
Dajte jedan ratifen. Još jedan.
Okay, you see that the needle is between the epiphysis and the diaphysis, a couple of millimeters from the periosteum, so we are quite in a good place. Would you like to check on lateral view?
Yeah, of course.
Check in lateral
lateral.
view. Place a lateral, and then I put my probe, my thermocouple inside it.
Moraš tamo, to. Idemo sad. Ne, odvoj, to, odlično. Ajmo.
Fine.
Dobro. Idemo dole.
Okay.
Ok. Možemo da vidimo?
Check for the.
Možete i vi, Vilbo. Da, ali gotovo već je napravio.
You see the needle is in the middle of at halfway through the bone, so 50% depth of the femur, which is usually the right location for the genicular nerve. And now we check
With the probe.
with the probe. So we do a sensory stimulation.
Marija, bit će nam potrebno da nam kažete da li vas boli i da li se bol pojačava kada dodamo.
02, 03,
Znate što je neprijatno je to, pa ne može da otvori.
Sada.
Jel boli?
06, 07,
She doesn't feel pain.
08, 09.
Nema bola, dobro.
It's on and it's 05 volts.
Okay. So we're looking for
Small adjustments.
small adjustment. There we are. Little bit.
Samo nemojte pomerati nogu, molim.
Now?
Should I stop it and start?
No, okay.
You'll tell us.
Da. Da li sada počinje bol?
See, okay, yes.
Se pojačava.
See if it's
Marija, da li boli?
increasing or not.
06.
Molim? Jel se pojačava bol? The pain decreased.
Okay.
I went to 0.8.
Okay.
Should we start again?
Did she feel
She
something?
felt pain, but it is decreasing, not increasing.
Ah, okay.
She felt pain because
Of the
Because
needle.
of the needle.
Yeah.
So we try to check better where we are. So you see and the needle tip is over here. Let's check.
Idemo senzorno. Marija, da li boli? Molim? Jel se pojačava bol?
Okay.
Da li se pojačavao bol sad?
Sad se vratilo, da.
Sada bol, da se pojačava ili ostaje isto? Ne, ali se pojačava. Ne.
Ne.
Ugašeni smo. We are off. Okay.
Yeah,
We do it again.
Uh-huh.
Jel se pojačava pitanje? Ceco, komunicirajte mi tamo.
Yeah.
08, 09.
Oh, yeah.
Stop.
Stop.
We are on 05.
You're on 05. Okay.
It's on.
I'll go closer. There we are. There we are. You see that. Close to the artery. Should be here.
I can see the needle tip.
You see, it's hard to see the needle tip.
Yeah,
I go in transverse view so we can see. Here we are. You see now. You see the needle
of course,
tip.
of course.
Okay, go a little bit against the periosteum, like that. Okay. Try. Okay, you see now the needle tip.
Yeah, of course.
There we are. I go straight against the periosteum. Try to.
Can we start?
Yeah.
03, 04, 5, 7, 8, 9.
Yeah.
Nema bola.
We are on 05.
Okay. Go up. Go up. Okay, that's the local anesthetic. Eh?
Should we check motor stimulation?
Yep.
Okay.
Okay. I think it's fine.
I'm increasing it.
Yep.
Do you feel any motor?
Motor?
No motor stimulation. We don't see any contraction. Let me check once more with fluoroscopy. Osman, kad se činamo? Superficial. Okay.
For the listeners,
Okay. And
We
we
have
do,
done sensory stimulation, and now we're doing motor stimulation. If we don't have motor response, we can proceed to radio frequency cool.
I need some local.
Local, lidocaine.
Local.
Može, sloniti.
Go.
We should wait 1 minute.
Ne, kontra.
We wait 1 minute.
Should we try another point?
Ne smeta, njima treba baš direktno na polje.
No, because I need demo couple, no problem. But you can, how long does it take to prime? 1 minute, 45 seconds.
Like 20 seconds, something like that.
Yeah, okay.
It's very painful, but really cool. Should we start it?
No, wait.
After the local anesthetic around the field that will be treated with radio frequency, we started radio frequency cooled ablation, neurotomy, and we set
Towards the feet.
machine to 60
down.
degrees, 2 minutes and 30 seconds. Now we are waiting for the probe to get to the desired temperature.
Okay.
And we are on plateau. We got the temperature and we are waiting. The impedance is okay. Marija, kako ste? Jel boli? Boli? Dobro.
Boli me.
She feels pain, but she can manage it. She can manage it.
Acceptable, tolerable.
Tolerable.
We can go back in
In AP view.
AP view.
Izvinite, Ate. Ne mogu se prebacim tako lako. Mislimo.
Još 55 sekundi.
Nije čisti AP, ja mislim. Jest, ok, izvinjavam se.
Let's check where we are.
To učinimo.
Okay. You see that the needle tip, the needle is at the junction between the epiphysis and the diaphysis, halfway through the bone, so the location is anatomical. And after the procedure, we will give the lady a mixture of long-lasting anesthetic and
1 milliliter.
okay, come on. Super, almost done. Now we will do the superolateral, the inferior medial, and the suprapatellar plexus.
Okay.
Okay?
Okay,
So
it's done.
before removing, I inject 1 ml. And then I remove, should not be any issue. Okay. But that, we change the needle.
That's why we have 3 of it.
That's why we have will put my needle. I hold it with just one moment of discomfort, and here we are. We can add some. Well, let's see. If we have to move, we will add some local anesthetic.
Marija, da li ste dobro?
We could check on the fluoroscopy where we are. Maybe shift trigger towards me. There we are. Okay.
It looks okay.
Looks okay. Let's check with the probe. Test.
Sada ćemo početi testiranje senzorno. Marija, da li osjećate bol? Da li se bol sada pojačava? Da li se pojačava bol?
Nije, nego boli na ugod i tu gdje je bilo, nije da se pojačava.
Doesn't increase pain.
Doesn't Kristen? Let's check it a little bit. Because the location looks perfect. So we check again a little bit. Okay. And you see the. Let's see if I can make you. Yeah.
Proba, senzorna.
Can we go lateral view so we check also?
Bravo.
Go.
Da li lateral view? Jača. The pain is decreasing.
Okay, perfect. So the.
No, you don't need ne treba.
No,
Ne treba. Provjerili smo.
This is the okay. No motor responses, so we are far from. Okay. No.
Ponovo, znači, nakon senzorne stimulacije, gdje je pacijentkinja osjećala pojačanje bola, uradili smo motornu stimulaciju, nismo imali motorni odgovor, dajemo lokalni anestetik, pre nego što započnemo radiofrekventnu ablaciju.
We wait 1 minute and then we start the procedure, because it's going to be painful, and then we will do the inframedial and then suprapapilla.
Još malo, Marija.
We ask the patient if the pain is tolerable or not. In this case, we do some local anesthetic.
Jel osjećate malo bol, Marija?
Ne, malo je umora.
Dobro. 2 minuta samo izdržite.
Okay.
Yeah, great.
Now we reach the temperature. We are 60 degrees. And
Nije me rekao joj. Ne rekao joj, nakon kad idem naše.
Koji ne vidi ga, toaletnom mraku je skroz. Sve što mraku ne možemo vidjeti. If you want something to show us, please put it on the light to camera.
Kažete, što još se treba?
Ima kolega odande bolje. Ima se pogledali da ovdje.
so 1 minute.
Još samo minut, Marija. Da.
Just mi fa Italia.
Yes. You understand, of course.
Vratite na kolena. Kolena, idem kolena slobodno.
30 seconds.
prvi, gotovi smo. She felt itching. She says that she felt itching.
She felt itching. Okay, that's normal.
Yeah, of course.
That's perfect. 1 ml. So 1.5. So we have 2 ml. 2 ml more. And again, put it up. And okay, the needle is still fine. Can I leave it just here? So inframedial is close to the tibia. Sometimes it's the most painful one, and freeze.
Freeze.
Perfect. So tibial shaft in the middle, and here we are the junction between the tibia and the femur. Look for the fluid, look for the artery. Okay, maybe over here the junction is put the collar.
CF button, and that.
In the middle. Okay, no. Okay. We got it. No, it's in the middle. Okay, in the middle. Okay, here we are. I'll put my.
Yeah.
And okay, you see the movement? Because you are out of plane, you want to see the needle tip. Here we are. Close to the periosteum. We could check just to go down. A bit more. Okay. Oh, you see the needle. The tip is on the upper side, close to the junction between the periosteum and the epiphysis and diaphysis. We put our probe and we see what happened. Here we are very superficial.
Marija, sad će možda početi bol, vi prijavite ako boli i ako se pojačava.
Ja ću trpiti dok mogu.
Samo recite da li boli.
Boli.
Da li se bol pojačava?
Boli ono osjećanje življeno.
Da li je prestalo?
Okay.
She felt pain.
Super. Okay. Motor stimulation. Would you? Because I take still the needle if you want to.
To what there is no.
Perfect. No motor contact. No. Place the local anesthetic. All the 2 ml. This is the, and we wait 30 seconds.
A little bit resistance.
It is.
Not much.
And we are. Super. I take the needle with my hands, so I stabilize it.
We can start?
Yes, we can start. If the patient will feel too much pain, we will stop. But this is very superficial and can be the most painful one, most uncomfortable one.
Marija, počinjemo. 2 minuta, samo izdržite. Ako dosta boli, recite da damo lek.
43. We raise the temperature up to 60.
She's saying that she feels pain that is going down.
Okay. Yes. Okay. We reach the temperature. So you see the procedure done under anesthesia is very fairly easy and
She's saying that this is the most painful part. Yeah.
I was not lying. So in fact we leave it for last. 1 minute.
Samo još minut.
Okay. One ml. Save 1 ml for the
of course. Okay.
Good to go. Now we change the needle. And we take. Can I leave this one? So super patella. Super patella. We look for the patella. Please.
Samo jedan mali ubod. Ovo neće biti bolan.
Patella on the right, and see, superpatella ligament, tendon, Wheeler pattern, environment, nice. And we go up until it merges into the vastus intermedius, about almost here. See, this is a muscular fibers, more dark and more black, and these are tendon fibers. We go up here where it merges. We go on the lateral view, transverse view, and we put some local. We want our needle to be just about the periosteum above the half a centimeter above the periosteum where the suprapatellar plexus should rise. We'll. Where is?
Sorry.
Okay. We put some local anesthetic in here.
Ubod mali, Marija.
Wait a little bit. If you want, we can check with fluoroscopy where our local anesthetic needle is. Is about 10 centimeters above the upper pole of the patella. Top. And here we are. You see? Let's see the patella. Maybe? No. Just going towards the field. Hold on. Super. The upper pole of the patella is at the lower part of the screen. And we point it out with a needle. Alright, this is where my needle is the upper pole of the patella. Okay, you see it? And I'm just above 4 fingers, a little bit more, so 10 centimeters more or less. Yeah. And we place our needle where we did a local anesthetic, and we look for that white spot just above the periosteum. I will put my needle right there. See. Here we are. See the needle? Now I'm against the periosteum. Okay, here we are. The needle tip is against the white area, it should be the suprapatellar plexus. So we inserted the probe. Here we don't use. We can use sensory stimulation, but sometimes we don't have a great response. Anyway, check. Should we check with that? Check. Go on.
Marija, da li ima bola?
Naravno, osjeća se, znate.
Minimum.
Problem. Motor stimulation. This is important because sometimes here we have contractions. Not in this case, so perfect. We can do our lesioning, some local anesthetic through the needle.
Evo imam više.
Okay. Okay. Go. Let's start. Let's go.
Za drugo, znači.
And we're done. 2 minutes and a half more and we're done.
Samo kako su napravili zahvalnost i slično, pa tek onda da se ide dalje. Prenosom nema.
Naravno, kad završimo
This is tolerated very well. Procedure. Then we will put the last ml of steroid, and here we go. One minute more and we're done.
Sad ćemo lepo da pokušamo.
30 seconds.
Možemo nazad na kolena. Kada?
Yeah, we're done. Okay, yeah, done. Well, Perfect. And we're done. Thank you, Dr. Andre. Thank you.
Okay, thank you. You just saw full radio frequency ablation of the genicular nerves of the right knee patient. Thank you for your attention, and now we will go. Thank you, Dr. Pinarello. We'll now go to the other operating room, and where you can see radio frequency ablation of medial branches.
Pozdravi.